Hi everybody. This video is a video for anyone who is either considering or is being advised that they should have a surgery to doing a VATS surgery or a video-assisted thoracic surgery or VATS to remove material off the outside of their lung and to also have the membrane removed from the inner chest wall to have the lung and the chest wall adhered together to eliminate reoccurring pleural effusions in the right lung, which is or the left lung or both sides, whatever your case may be. Mine's the right side. So a little bit of a timeline. The middle of December of 2019, I had my VATS surgery done to remove the material off of my right lung. It was pushing my lung in approximately about 40+%. So the lung from the bottom up with the material and the fluid buildup had compressed the lung in and was limiting the amount of usage of my right lung that I had, and my heart rate actually went up as a result into the low 90s to, or the high 90s, mid-level 90s to very low 100s as a result of that. So after having been diagnosed with having pleural effusions and having two thoracentesis procedures. A thoracentesis is a procedure where they take a needle, a hypodermic needle. They locate the bottom area of your lung cavity, the empty space between the chest wall and the lung, along your back, and they find the ribs there and insert a needle between the ribs and push it into that space and draw the fluid off, which re-expands the lung, and in some cases solves your problem. The fluid doesn't come back, but in my case, and maybe in yours, the fluid returns. So you have two choices. You can go back and have another thoracentesis again in a couple of months, pull all that fluid off, and you just keep in that cycle of drain fluid, drain fluid, drain fluid, drain fluid. In my case, my pleural effusion was reoccurring, was able to do two thoracentesis procedures successfully and re-expand the lung, improve my breathing, and then the third time I did it, and this all happened over the course, a little over the course of about a year plus. So the third time I did it, they tried to insert the needle, and it was much more painful than the previous two thoracentesis attempts. And when they finally did get the needle in and they started drawing the fluid, I felt the most excruciating pain that I think I had felt to that point. And that was indicating that the lung was not re-expanding. The material had grown over the lung enough that it didn't allow for it to expand. So the only thing that was able to move at all was my rib cage, and it pulled my rib cage in and began to hurt in a way that I had never felt before in my life. Told them to stop. I couldn't do it, and what was coming out and into the jar was not yellowish or clear or anything else. This was a darker red, obvious buildup of some kind of a problem. At that point, my doctors advised that I needed to have a VATS surgery and have a pleurectomy with pleurodesis done, which is removal of the material from my lung, the removal of the membrane on the inside of the chest wall, kind of what you see on the back of like ribs when you buy ribs and peel that membrane off before you cook them. They do the same thing. They pull that membrane off the inside of your ribs and then put a solution on the outside of the lung and the chest wall, and then using chest tubes suck all the space out or the air out and pull the lung against the chest wall, and those two adhere to one another. And that eliminates the space for any fluid to ever build up and return in that space and affect the lung, and forces your body to absorb it and get rid of it. So that's where I'm at. I'm about 3+ weeks post VATS surgery, having had a pleurectomy with pleurodesis done. What I can tell you is it is a slow healing process. It is not fast. I've had multiple other surgeries in my life. I've had, I'm a disabled combat vet. I've had knee surgery. I've had ankle and foot surgeries. I've had heart procedures where they put catheters up through my leg to my heart, and done things of that nature. I've had other surgeries done where I bounce back really fast. Not in this case. This surgery put me on my backside pretty hard, and thankfully I've got a really good support system. My wife is off right now from it's her regular time off from work, so she's had a few weeks to be here, and has helped out a lot. So my hat's off to her. What you should know going into this: if they recommend this surgery, it's because of the fact that they can't successfully remove the fluid anymore, and it's reoccurring and it's continuing to come in. So you can either leave it and damage your lung permanently, or you can do something about it, as I did, and try to rectify the problem permanently. There is a lot of fine print and stuff they don't tell you in the surgery prep, and that's what I want to concentrate on. I was told there was going to be some incisions made, and they were going to use laparoscopic tools, and I was going to peel some stuff off, and you can go on YouTube and you can find all these videos, and it shows you the graphics, and you can see how the material's removed and it's put into a bag and pulled to an incision, and it looks straightforward and fairly simple. The reality is I woke up from the surgery with not just some laparoscopic punctures. I woke up with 2 laparoscopic punctures, a 3-inch incision on my midline rib cage, and a 4-inch incision between my armpit and the top of my rib cage on my right side, which nobody told me about. So that was completely unexpected. It caused far more pain than I thought it was going to be. I thought it was going to be a laparoscopic scar. I knew there was going to be chest tubes inserted post-surgery where they used the laparoscopic tools. There was going to be pain medication, that sort of thing, but it was far, far more involved. So know that going in. It's going to be a little more complicated than what they're leading on with. So ask those questions. Ask them if they're going to make an incision up above or below your armpit on the right side, if they're going to make an incision along your rib cage, and how many punctures they're going to do. You're going to need to know all that. So they just told me they were just going to make some incisions and go in, get it done, quick surgery, they said. And it took about 2 hours. It was relatively quick, but there was a lot more invasive incisions and surgery than what was originally told. So I wake up, I'm coming out of general anesthesia. I'm groggy. I want to see my wife. I see her. I see some of the other family members, and then they take me upstairs and they put me in my recovery room. I'm on a constant, or I was on a constant, 0.1 milligram dilaudid infusion, constant. And then as needed, I had a button I could push, and it would give me 0.2 milligrams of dilaudid when I pushed it, and it would reset every 10 minutes. So in between there, if I wanted, I could take some oral oxycodone if I wanted it. I never had to. The dilaudid seemed to work well enough. But about the third day, they'll come in and remove your chest tubes because the lung would have adhered by then. You're going to be in the hospital anywhere between 3 to 5 days, depending on how long it takes for that lung to adhere. And so mine took about 2.5, 3 days. They came in, took out the chest tubes, which was to date probably the most intense pain I've ever been in my life. When they got done, I was looking for my honorary giving birth pain certificate from the Women's Society for honorary childbirth pain. It was horrible, really bad, but thankfully it went away pretty fast, and I had my pain clicker, so I was clicking that sucker, and that managed to get things under control. And then later that day, about 4 hours later, I was discharged. And so I went in on Monday. By Thursday afternoon, I was in the car on my way home. Do yourself a favor. If you are going to have this procedure, if you're going to have a VATS surgery and it's going to have, you're going to have material taken off your lung and this membrane pulled and your lung adhered, it's going to hurt to get up out of bed. It's going to hurt to stand up. It's going to hurt to move around and breathe. You're going to want to make your life as easy as possible. So do yourself a favor. Get one of these. Okay, I got this table off Amazon. It was about $25 or $30. Has little roller wheels on it. It's adjustable, has shelves on it. It has all of my medications, my water at nighttime, remotes. It has everything that I need, lidocaine patches, has everything else they gave me to do this. And it can wheel right up to your bed and be close to you at night. So get yourself a rolling little table that will be next to your bed that you can easily just reach over and grab things and have them directly at your fingertips instead of trying to get up out of bed or have it there. It's great for meals, for eating a snack, whatever. When you do get up out of bed, it's going to hurt like hell, but do yourself a favor. Take a bath, take a shower in the morning when you get up, right after you leave the hospital. They'll tell you to start taking showers. Don't worry about the sutures. They're not going to dissolve. You're going to get those taken out a week afterwards. There are dissolving sutures in there. I still have some of them in me. They haven't come out yet. After 3 weeks, some of them I was able to remove, and they came right out about a week later. Others are being a little bit more stubborn, and I'm just leaving them alone. They'll dissolve and come out on their own. But take a shower in the morning and take one before you go to bed. It will loosen things up. You're going to want to kind of just stretch your arm occasionally, stretch your body out a little bit. You're going to want to get some range of motion. It's going to hurt. They are most likely going to take a device and they're going to inject a nerve block along your center area of your chest. This area of my chest right here is still numb 3 weeks later. There is pain now coming back pretty intense because the nerve block is worn off. things were getting a little better. I was able to move around pretty decent, and then the nerve block started wearing off, and my pain is intensifying again. You will still experience some shortness of breath, and that is from your body undergoing trauma from the surgery, and it still is trying to adapt to having a full expanded lung. You are going to be coughing up all kinds of clear crap out of your lungs because your lung was compressed. All these things. So I'm going to try to post this online for you and let the world see it and have it. If you have questions, like I said, I'm going to put it on my YouTube channel. So if you have questions and you come across this video and you listen to it and you have additional questions, message me, and I will try to get back to you as fast as I can and give you any information about the surgery or something that maybe I didn't cover. But make your life as simple as possible. You're going to want some kind of little something to suck on, candy or something else. Your pain meds that you're going to be taking, it might be Vicodin, might be oxycodone, something else that they give you. You're going to be taking that. It's going to dry your mouth out. Water, you can drink it, but it's going to go away. It's going to come back, and you're going to have dry mouth, just perpetual dry mouth. So I ended up investing in candy. So if you're diabetic, you can't do that, then look at some sugar-free options, or look at something, just something that you can suck on and keep your mouth salivating and keep it moist, because it dries out, and especially when you wake up in the morning, your mouth feels like it went through a cotton farm, and it's painful, it's dry, and you're immediately drinking water, and you can hear my throat's dried out right now. From pain med use, and just the fact that it's winter and it's a little drier than usual right now. So, like I said, contact me and let me know any questions you have. But that's what you need to know going in. Is it can be a little bit more complicated than they lead on. You're going to come home. You are going to hurt. You are going to be coughing up blood chunks. I can tell you that right now. You're going to be coughing up chunks of coagulated blood from where they peel the stuff off the lung. It creates little micro holes, and blood gets in there. It congeals, and over a course of a week or so, you're coughing up this congealed blood for the better part of 4 or 5 days. And they'll start out larger, they'll get smaller, they'll disappear, and then you'll start getting like clear fluid up and stuff like that, and then you'll finally just be how it is. But be prepared for coughing up a little bit of blood after the surgery. It's a little disconcerting, but they tell me it's normal. So mine stopped. It was a little bit nerve-wracking at first, but managed to get a handle on it. But message me if you have any questions, and hopefully this video helps you and helps your preparation and what you're going to be getting into. And hopefully, if you do have to have the surgery, all I can ask for is a safe and successful surgery, and that you recover as quickly as possible. So you got my thoughts and prayers there. So let me know if you have any questions. Hope this helps you. Thanks. Bye.